we do a mic check? Did we hear that feedback? We can hear in the back? Okay, I see some thumbs up. Well then, good afternoon, everyone. My name is Kathy Temple. I'm the Director of Employee Experience, and I'd like to welcome you to our 2021 recognition celebration. Things are definitely a little bit different this year. We definitely have a new venue and some great faces, so I'd like to welcome you all to our event. All of our recognition nominees today have shown themselves to be outstanding role models of the UI Care behaviors, and it truly is my honor to be able to lead this ceremony for you all today. I did unmask today, and we're only asking folks who are up here at the microphone speaking to unmask. We'd like to also ask you to all keep your masks on as well, and our panel up in front will do the same, and again, unless they're over here at the podium speaking. I'd like to introduce you to Dr. Robert Barish, our Vice Chancellor of Health Affairs, to come and share a few words with us. So, Dr. Barish.
Okay, thanks, Kathy. Well, good afternoon, and welcome to our UI Health employees and physicians gathered for today's celebration. On behalf of the entire academic health enterprise, it's my pleasure to recognize the contributions and sacrifice that each of you has made during this past year and more, and what a year it's been. So without a doubt, the COVID-19 pandemic has posed unprecedented challenges for our healthcare systems and teams. And yet, I'm always inspired by the many ways that our university has found ways of collaborating to enhance our efforts to address the needs of our patients and students. So for over a year and a half, members of our UI Health staff have been on the forefront of the COVID-19 pandemic. We recognize that during such a demanding time in our history, and again, this is historic, it's more important than ever to celebrate the achievements of our incredible network of healthcare professionals. So UI Health is proud that all our employees and the relationships that we have built across the hospital and clinics, the colleges, and the entire university. So together, we can truly build a better future together. So that's why today, the awards for Nursing Excellence, Employee of the Year, Resident of the Year, Physician of the Year, and the inaugural presentation of the Advanced Practice Provider of the Year. You know, I often say that healthcare is a team sport, and although we're honoring several specific individuals, know that each of you reflect the best of those that we're celebrating today. So on behalf of the entire academic health enterprise, I would like to salute each of our recipients and thank them for their daily inspiration and leadership to care for our patients and their families. So thank you and congratulations.
Okay. Oh, you do have your clappers and your maracas, so feel free to make some noise. There we go. So I'd like to, thank you, Dr. Barish. The first group of award recipients we'd like to recognize are our 2021 Nurse Excellence Award recipients. The Excellence in Nurse Leadership Award acknowledges UI Health nursing staff nominated by their peers for excellence in leadership, mentoring, professional practice, and quality. Each of these award recipients were named earlier this year in May during the annual Nurses Week celebration. I'd like to introduce them all to you. I will ask for you to hold your applause until we have all of them on stage. And Mike and Dr. Barish, I'd invite you to join us mid-stage then for a photo. For excellence in clinical nursing, we have Deborah Cooler from the emergency department. Come on down. For excellence in education and mentorship, Christina Diaz, clinical practice and professional development. Excellence in nursing leadership, Maritza Moreno from Ambulatory Services Administration. Excellent in patient care support, Sonia Ramus from 7 East Medicine. Excellence in community care, Michelle Martinez from Miles Squared Humboldt Park. And our rising star, Tanetta Smith, also from 7 East Medicine. Please go ahead and join me in congratulating all of our recipients. It's like you're at your prom, where we all stare at the people in front of us having their picture taken.
All right.
Congratulations to all of them. We'd like to now move on to our of the year recipients, nominees and recipients. And what we'd like to do is we will introduce you to all of the nominees in all of our 4 categories. When your name is called, we'll ask you to come to the stage and again have another photo taken, and we'll share a small snippet of your nomination with everyone so you can understand why these folks are so great, and we're so honored to be here with you all today. So again, when I call your name, please come down to the front. Marcelo Iglesias, Statistical Analysis from the Patient Experience Team. Marcelo is always engaging and provides relevant, timely, and accurate information. His steadfast leadership has influenced the increasing momentum we have witnessed around our patient satisfaction score. Marcelo's dedication to excellence is admirable. He embodies the very essence and spirit of this award. So Mike and Dr. Barish, if you'd like to come forward and stand with Marcelo, and we'll take a picture, and then we'll say congratulations to Marcelo. Mike and Dr. Barish, if you'd like to stay right there. Next up, we'd like to invite Neil Sheath, IT Manager, Telcom from Information Services, to the stage. Neil's work ethic, positive attitude, and creativity helped carry UI Health through the darkest days of the pandemic and beyond. Neil is the kind of leader and colleague that receives an urgent, massive request, tells you his team will take care of it, and before you know it, he's completed it, sometimes often in the middle of the night. Neil focuses on delivering a fast turnaround on changes we need in a thoughtful manner. So congratulations to Neil. Next, I'd like to invite Isaiah Torres, Assistant Director of the Neurosciences Center, to the stage. A part of Isaiah's strength is his consistent, friendly, engaging, and positive attitude. He has been the calm for his team in what has been a difficult year. His leadership and dedication to improving care for our community penetrates the staff and providers and has led to an amazing team effort to all who are proud to wear the UI Health badge every day. Congratulations to Isaiah. Next, I'd like to invite Jonathan Lopez, Central Store Manager, Materials Management, to the stage. Every interaction with Jonathan is polite, professional, and courteous. He carries a positive attitude that seems to uplift those he comes into contact with. Jonathan is an excellent collaborator across all areas of UI Health. He is always available and accountable. So congratulations to Jonathan. Next, I'd like to invite Dennis Pablano, staff nurse from Surgical Service, to the podium. Dennis embodies what everyone should strive for at UI Health. He is an exceptional nurse who stands out amongst his peers. He is hardworking, honest, kind, and treats staff and patients with the utmost respect. He has a great attitude, and when he is in the operating room, he makes a pleasant place to work. So how about congratulations to Dennis? Congratulations, Dennis. Next, I'd like to invite up Michael Seafick, Business Administrative Associate from Imaging and Diagnostic Services. Michael is passionate about healthcare and looks for a way to improve front-end operations, development of staff, and patient satisfaction. Michael is kind-hearted, funny, compassionate, and the epitome of professional. He has demonstrated himself to be an exceptional leader, and even more so during the pandemic. So congratulations to Michael. Next, I'd like to invite Adriana Valencia from the transplant team to the stage. What makes Adriana invaluable to UI Health is her consistent positive attitude and willingness to go above and beyond. Adriana is the rock of the transplant team because she is always reliable, willing to jump in to support any difficult project, and always willing to lend her sage wisdom. So congratulations, Adriana. Congratulations. Next, I'd like to invite up Lisa Carradine, Senior Director, Employee Services from Human Resources. Lisa truly shines during challenging situations. The most recent was her involvement with supporting the organization during the current pandemic response. Her leadership and extraordinary efforts allow her to meet the needs of both the employees and the organization. Lisa is a tireless advocate for UI Health who works across the organization to ensure success. So congratulations to Lisa. Next, I'd like to invite up Ashley Orama, Human Resources Associate from Human Resources. Ashley comes to work positive and upbeat, making her colleagues eager to get the job done. She understands the urgency of filling nursing positions and works collaboratively with leadership to provide the resources they need. Ashley is the best of the best. Humble, knowledgeable, caring, and committed, she is indeed a difference maker. Congratulations, Ashley. Also a nominee, but not able to be with us today, is Beth Dodge, Coordinator of Occupational Therapy. And she's enjoying some time off. And Beth, if you're watching, we'll send a shout out to you as well. So while each of these employees is certainly very deserving, there can only be one Employee of the Year. And I'm going to read you a bit more of this person's nomination, and we'll try not to reveal it to the big reveal at the end, but bear with me. This person was vital to supporting the hospital during the pandemic. His leadership was and is crucial in maintaining safety and operations at UI Health. He is one of the most collaborative professionals at UI Health and is a trusted partner in our supply management. He is an exemplary employee who demonstrated extraordinary work during the past year. The pandemic illuminated to every area of the hospital how vital the materials management department is to maintaining safety and operations. Our Employee of the Year was consistently reliable, helpful, always friendly, and supportive regardless of the need or ask. When special projects such as the Employee Vaccine Clinic or the Credit One Arena Mass Vaccination Clinic was developed, he always found a way to design and implement an effective process for receiving and maintaining supplies. When an item was needed on an urgent basis, our Employee of the Year frequently made the deliveries himself. Our Employee of the Year was a rock with supply chain disruptions, juggling limited resources, and giving great customer service to the entire organization. He could frequently be found making deliveries to our offsite location. When supplies were found to be low, he was always able to locate them, specify instructions to his team, and advocate for best practices in delivery and care. Without people like our Employee of the Year, we would not be successful in ensuring we have the supplies we need for our employees and for our patients. So it gives me great pleasure to introduce you to our extraordinary Employee of the Year, Jonathan Lopez. And as a special surprise, we do have Jonathan's family coming in to join him as well. So Jonathan, congratulations. Come on, family, come on up, don't be shy. There we go. And then Bob, we can take it more forward. There we go. It's behind the curtain. All right, congratulations again, Jonathan. So we'd now like to switch over to our Resident Fellow of the Year nominees. And again, when I call your name, I'd like to ask you to please join us on stage, please. The first resident we'd like to introduce you to is Lily Cheng, resident of Emergency Medicine, Internal Medicine. And Drs. Prendergast and Van Hoeken, would you like to join Mike and Dr. Barish for photos, please? Lily holds herself to incredibly high standards and has demonstrated a relentless focus on making things better for both patients and colleagues. Lily is dedicated to working as part of a multidisciplinary team and actively engages nursing colleagues and other residents in part of the resuscitation boot camp. Lily often takes the initiative to take care of our sickest patients and is very patient with her interns while pushing them to do her best. Congratulations to Lily. Next, I'd like to invite Andrew Christiana from Neurology. Is Andrew with us today? No, Andrew was not able to be with us today. Okay, well, Andrew, we wish you a shout out if you are watching. Next, we'd like to invite Gabe Moreo Riviera, Chief Resident from Internal Medicine. Gabrielle? Gabe is an effective, deliberate, and compassionate physician. He has shown himself to be detail-oriented and proven to be someone who doesn't go to pieces in an emergency. He spearheaded efforts to move patients safely through our hospital system, even very early in the pandemic, collaborating with nursing, infection control, and discharge planning to ensure what we were doing for our patients was the best. So congratulations to Gabe. Next, I'd like to invite Anna Morrow, Chief Resident for Pediatrics, to please join us up front. Anna's passion and optimism have been undeterred by the relentless pandemic. And in fact, they fuel her to view every situation as an opportunity for advocacy. When providing direct patient care, Anna considers every angle: the home environment, the stressors of working parents, the barriers when English is a second language, and she handles those with grace. Patients and families trust Dr. Morrow in the fact that she views each patient encounter as a privilege, and that's very appreciated by all around her. So congratulations, Dr. Morrow. Next, I'd like to invite up Sonia Mohan, fellow from Child and Adolescent Psychiatry. Sonia is truly invested in providing the highest quality care to her patients. She has been able to overcome racial and social barriers with the families she cares for to become a provider that they can relate to and see as an understanding comfort. Her advocacy for and dedication to the mental health care of our youth in the hospital has been well noted by the faculty and staff. So congratulations, Sonia. Next, I'd like to invite up Taryn Murray, Chief Resident for Dermatology. Dr. Taryn with us? Okay. Congratulations to Dr. Taryn, also nominated for today. Next up, Antoinette Price, Co-Chief Resident for Family and Community Medicine. Antoinette is committed to caring for the underserved and marginalized and vulnerable populations with particular attention to social determinants of health. She understands that medical inequities are revealed through the effects of social determinants and focuses her medical practice on improving patients' medical condition by addressing such deterrents. So congratulations, Antoinette. Next, I'd like to invite up Susan Talamini, resident in urology. Susan's good nature and sense of humor are her superpowers. These gifts inspire the entire medical team to extraordinary levels of excellence. Susan is a skilled surgeon and excels in open, endoscopic, laparoscopic, and robotic surgery. She is very diligent and takes excellent and compassionate care of our patients, and she has established good personal relationships with her professors, peers, nurses, patients, and families. So congratulations to Susan. Next, we'd like to invite up Christian Vox, Fellow of Pulmonary Medicine. Kristen consistently demonstrates great enthusiasm for patient care and a passion for clinical education. During the early difficult days of the pandemic, she demonstrated incredible strength and poise, taking on extra clinical responsibilities and always helping others where needed. She is dedicated, motivated, and enthusiastic physician who works tirelessly and is guided by a strong dedication to our healthcare mission. So congratulations. And then also nominated but unable to be with us today are Allie Cord, resident of radiology, and Hari Vignewaran, resident of urology, and we wish them both congratulations as well. I'd like to now invite Dr. Prendergast to come over, and she will share with you some of the story of our 2021 Resident of the Year.
All right. Good afternoon. Okay, our 2021 Resident or Fellow of the Year is someone who is dedicated to our clinical mission as well as to excellence in teaching and being a better leader. As a provider, our Person of the Year spent several weeks caring directly for our sickest COVID patients. This was the most difficult and grueling work any of us had engaged in, trying to care for patients with a life-threatening illness that we did not fully understand and had limited ability to treat, in an environment that posed significant risks to providers at all levels due to the nature of the disease, and at the time, very limited PPE. Our Fellow of the Year helped us navigate these difficult times by coordinating schedules and willingly committed herself to the front lines as a senior fellow who took on extra clinical obligations to provide direct patient care. Our Fellow of the Year played a crucial role during this time that ensured both our ability to deliver the highest levels of patient care and provider safety. At the same time, our Fellow of the Year was responsible for ensuring that our educational mission was never compromised in any way. Never has the focus in education of our providers been so critically important as we have learned in this real time how to best provide care for COVID patients. Our Fellow of the Year personally coordinated and frequently moderated our daily divisional multidisciplinary educational conferences for faculty and fellows and helped support our divisional wellness committee. Our Fellow of the Year is an exemplary fellow who has demonstrated a high degree of passion for her work, including a dedication to her dual roles as an educator and as a clinician. She has the promise of a remarkable career going forward. Please join me in congratulating our 2021 Fellow of the Year, Dr. Christine Box.
Yeah, got to get the big check first, right? Oh, yeah. Okay, Dr. Vandenhoek is going to introduce our next award.
So we are very excited for our next award, and this is its inaugural year. It's the Advanced Practice Provider of the Year Award. Our advanced practice providers are an important part of the care team here at UI Health. They are trusted medical professionals who work hand in hand with physicians and nurses to create a seamless environment of care. APPs do much more than just deliver care. They are fundamental to medical education, mentoring, and advocates for our patient population. I'd like to give a shout out to Shelley Major and Cisse Mersha for their work in supporting and leading our amazing group of APPs. And I want to thank Cisse particularly for working with us to establish this award this year. I will let Kathy now introduce you to our Advanced Practice Provider of the Year nominees. When she calls out your name, please come and join us on the stage.
Thanks, Dr. Vandenhoek. I'd like to first invite up Tracy Abraham, APP from OBGYN. Tracy leads with a kind, authentic manner. She is consistently asking how she can do more and what else she could do. As a member of the APP Research Council, Tracy has been a strong content expert, facilitator, and mentor. Tracy is kind and a genuine force within UI Health, and she consistently gives of herself to her patients and to her colleagues. So congratulations, Tracy. Next, I'd like to invite up Joshua Baxter from the Emergency Department. Josh has a unique ability to show empathy towards every patient he interacts with. His exceptional clinical acumen allows for the excellent delivery of quality care in our busy setting. In addition, he contributes to the growth of nursing professionals by giving his time in precepting nurse practitioner students in the ED. Congratulations to Joshua. Next, I'd like to invite up Christine Bobek from Family and Community Medicine. Chris is a gentle, kind force who, in addition to her significant clinical contributions, has provided invaluable guidance to nursing students. Chris's dedication has been exemplary, as evidenced by many patients, including our faculty, praising her patient-centered caring attitude. So congratulations to Christine. Next, I'd like to invite up Miriam Correa from the Supportive Care Team. Miriam's dedication, perseverance, organization, and above all, people skills are only a few of the qualities that allow her to advance and be remarkable with everything she does. Miriam has been a true pillar of strength for the entire palliative and supportive care team. Nurses are consistently approaching her to discuss patients, seek guidance, and get emotional support if they've struggled through this past year. Congratulations to Miriam. Next, we'd like to invite up Carolyn Dickens, Medicine Cardiology. Caroline's thoughtful and compassionate approach goes beyond expert treatment of cardiac diseases to address the multiple challenges faced by our underserved patient population. Caroline has been a true warrior throughout the COVID-19 pandemic. She was instrumental in the development, implementation, and optimization of an APRN ICU in service. Her partnership has been invaluable to improving the efficiency of our APP practice. Congratulations to Carolyn. Next, I'd like to invite Jessie Haran, Mood and Anxiety Program, to the stage. Jessie takes on some of the most challenging patients who have significant psychiatric and social dysfunction, and he manages them with great empathy and competency. Jessie was the EPIC champion for our department and continues to provide support and insights to facilitate the efficient use of EPIC. Jessie is a valued contributor and cheerleader within our division, supporting his colleagues, especially during this challenging year. Congratulations to Jessie. Next, I'd like to invite up Christine Horn from Pediatrics. Christine provides clinical biochemical services for UI Health, and her clinical judgment is outstanding. She has saved the lives of countless infants and inborn errors of metabolism because she is quick thinking and has excellent clinical reasoning. Not only is she a lifelong learner, but she has a deep passion for educating the next generation of healthcare providers. Congratulations to Christine. Next, I'd like to invite up Michael Huke, Family Medicine from Mile Square. Michael provides excellent evidence-based care to all patients with respect, kindness, and he pays particular attention to reducing stigma for the most vulnerable populations. Michael is an enthusiastic supporter of both nursing faculty practice and UI Health Systems initiatives, and we say congratulations to Michael. Next, we'd like to invite Stacy Kellerman, Anesthesiology, to the podium. Stacy epitomizes professionalism, integrity, dedication, and quiet confidence. She is an excellent role model as a caregiver and has a true team approach and is admired by all surgeons and operating room staff. We say congratulations to Stacy. Thank you, Stacy. Next, we'd like to invite Karen Morgan, OBGYN, to the stage. Karen takes excellent care of her patients and has been integral in helping the team provide a holistic approach to patients and their unique needs. Karen not only champions all peer-to-peer and appeal endeavors, she makes it a point of knowing the patient beyond their diagnosis, anchoring her clinical practice in genuine humanity and natural empathy. So congratulations to Karen. Next, we'd like to invite Jovan Owens, Hematology Oncology. Please join us. Jovan is the type of person who looks ahead and solves problems before they have a chance to surface. She has shown herself to be a true team player, putting the needs of the clinic and the patients above her own. She has proven to be valuable in terms of her willingness and ability to take on new challenges in order to provide critical services that are needed in the Mill Square Clinic. Are needed into the clinic. So congratulations to Giovanni. Next, we'd like to ask up is Mary Pasquinelli, Hematology Oncology. Mary is one of the fiercest patient advocates I know. What makes Mary special is her willingness to roll up her sleeves, her dedications to the patients we serve, and her passion for improving outcomes in the field of lung, neck, and head cancers. Mary had a primary role in developing a leading lung cancer screening program that uniquely benefits our diverse patient population. So congratulations to Mary. Next, we invite up Elizabeth Schreiber, Clinical Decision Unit. Elizabeth has demonstrated a clear and consistent drive to dedicate her work to the betterment of our patient population. She has been instrumental in managing the distribution of our APP staff from the CDU as hospital needs have evolved over the past year. Her work was then, and now, critical to the continued fundamental operations of this hospital. She exemplifies what it means to serve our patients and hospital family with grace, dedication, and intelligence. Congratulations to Elizabeth. We'd like to invite up Trinette Zahakailo to the stage, APP from University Health Services. On a daily basis, Trin displays a level of accountability, compassion, respect, and excellence that goes above and beyond. During the height of the pandemic, Trin demonstrated compassion for those COVID-positive patients who were scared and frightened about having the virus when so much was so unknown. Congratulations to Trin. And then also nominated but unable to be with us today was Helen Geim from Mile Square Urgent Care. She is, I believe, working in the clinic today. So we say congratulations to Helen. I'd like to invite over Dr. Vandenhoek to then announce our APP of the year.
So it's now time to announce our first Advanced Practice Provider of the Year. Prior to the pandemic, this person touched many lives by providing assessment and treatment to our injured workers, helping with leave or return to work issues related to illness or disability, implementing surveillance programs to monitor the health of employees, and providing a comforting hand and resources when employees were in crisis. Our APP of the Year has also influenced many students from the health sciences colleges by providing education and competencies for hundreds of nursing and pharmacy students for mass flu vaccination events, by acting as a preceptor for many APRN students, teaching them the role of occupational health nurse practitioner, and by orienting and consulting with physician residents in our specialty. Many people have been touched with her expertise. This year, however, her skills were challenged and her true talent was revealed as she became responsible for leadership oversight of the COVID-19 response teams. During the initial phases of the pandemic, our APP of the Year experienced the overwhelming challenge of consulting with over 100 students and volunteers on COVID-19 exposures, travel consultations, and return to work issues. This quickly evolved into the COVID response teams, which are still maintained today. Our APP of the Year was the main contributor for development and implementation of the team approach, and she was able to craft a team that was comprised of staff from multiple sources, including redeployed staff, agency workers, volunteers, and students. With the help of temporary workers, she organized and implemented guidelines for multiple COVID response teams, which included contact tracking, notification of new positive test results, exposure monitoring and reporting of negative results, and active monitoring of ill workers and passive monitoring of exposed workers. She was instrumental in the review and frequent reevaluation to processes to meet the needs of UIH and UIC. She collaborated with leadership from multiple disciplines, including infection prevention, pathology lab, campus contact tracing, and campus leadership, to provide education and consultation to mitigate further spread of illness. There are just a few reasons why she is our Advanced Practice Provider of the Year. These are just a few. Please join me in saying congratulations to Trinette Zahakelo.
Katie? So Trin's husband called Trin a little bit ago before we started and said, they won't let me in because of COVID. Surprise! Oh, yay! Congratulations, Trin. Well done, sir. Hi. Gotcha. Oh, you gotta go that way. We're going to move on now to our last award category, which would be for the Physician of the Year. And once again, I'll introduce you to all of our great nominees. When I call your name, please come join us on stage. First, we'll start with Kelsey Evans from Internal Medicine Pediatrics. Kelsey was instrumental in creating the freestanding COVID testing clinic in Pilsen. She set up impeccable systems to keep the staff and other patients safe. Kelsey arranged for a true team-based care. She ensured every patient would get a follow-up call with the result of their testing. And this was key so that the patients would have a trusted person to talk to when they tested positive, to make sure they knew how to keep them safe, themselves and their loved ones safe. So congratulations, Kelsey. Next, we'd like to invite Dr. Susan Bleasdale from Infectious Disease to join us up front. Part of Dr. Bleasdale's nomination reads as, Susan has shown an extraordinary commitment to her patients, healthcare research, and the community more so than ever this past year. While she was managing the pandemic response for UI Health, she was simultaneously helping to manage COVID-19 outbreaks in congregate living settings, such as skilled nursing facilities and prisons, via consulting contract with IDPH. What was most remarkable is that in the midst of managing the great infection control challenge of the last century, she never lost her focus on treating others with kindness and compassion. Congratulations, Susan. Next, we'd like to invite up Edwin Cook, Psychiatry. Edwin provides excellent patient care and both teaches and encourages others to do the same. He is a fierce advocate for patients and staff alike. He has created and supported several initiatives designed to improve patient care and foster faculty development. He has also created an environment of active learning and education for faculty and residents. Congratulations, Edwin. Next, I'd like to invite up Ron Gava, Interventional Radiology. Ron delivers world-class, evidence-based care. His selfless dedication to his patients is always on display for our medical students and residents to see. His patients truly appreciate and trust him because of the time it takes to get to know them, explain their condition, and answer their questions about a treatment plan. Truly patient-centered care. Congratulations, Ron. Next, we'd like to invite up Zara Hajiri Medicine, Transplant Nephrology. Zara is an excellent academic. I was impressed by her thoughtfulness and diligence when redesigning the curriculum for the Transplant Fellowship Program. She has a tremendous work ethic and is always prepared and willing to take on challenges, including taking on extra work when we had a shortage of nephrologists during the pandemic. Congratulations to Zara. Next, we'd like to invite up Brandon Harris, Family Medicine. At the start of the pandemic, Brandon was designated as the lead of the new UI Health COVID Outreach Project, which was tasked with calling patients with a recent COVID diagnosis. Through his collaborating and leadership approach, the team made over 6,000 calls to over 2,000 patients with a COVID plus diagnosis at UI Health. This project led to a reduced readmission rate and a positive effect with procuring resources that were identified during the calls. Congratulations, Brandon. Next, I'd like to invite up Michael Huber, Internal Medicine and Geriatrics. As a palliative care physician, he truly has the patient's best interest at heart and clearly acts as an advocate on their behalf. Michael has led the ethics committee, and under his leadership, the committee was charged with very difficult decisions in creating policies that were emotionally charged in very uncertain times. He's respectful of those around him, but he always puts the patient first. Congratulations, Michael. We'd like to next invite up Jeffrey Jacobson, Medicine. He left for the clinic. Okay, well, we will send a shout out to him and we will make sure he gets his accolades. Next, we'd like to invite Ariel Leifer, Family and Community Medicine, to this podium. Ariel puts the patient first in all her encounters and consistently contributes to the delivery of world-class patient care. She is responsible and a great collaborator whenever and wherever needed. She fosters an environment that is positive, respectful, fair, and diverse. So congratulations, Doctor. Next, we'd like to invite up Dr. Janet Lynn, Emergency Medicine. Janet has always had a desire to improve patient care while adhering to evidence-based guidelines. She has worked with the Center for Global Health and is an international expert on disaster preparedness and was instrumental in leading UI Health through the pandemic. She has adeptly and graciously led us through this past year and a half while maintaining her cool and calm demeanor. Congratulations, Janet. We'd like to next invite up Stockton Mayer, Infectious Diseases. At the start of the pandemic, Stockton joined a group of concerned healthcare providers from UI Health and other hospitals to address the concerns of COVID in homeless shelters. He worked with CDPH to set up a COVID-19 screening program, which moved from shelter to shelter. This program was very effective and pivotal in stemming the spread. He is now working on delivering the vaccines to these same locations. Stockton asks nothing for himself and is in his element when helping others. Congratulations, Stockton. Next, we'd like to invite up Kenneth Moore from Neurology. Kenneth brings his years of experience and kindness to work every day. He is approachable and will assist staff with clinical questions. His enthusiasm for teaching comes across by him providing literature when staff ask him a clinical question. He treats his patients with a caring approach using much compassion, and he inspires many here in the clinic. Congratulations to Kenneth. Next, we'd like to invite up Ashley Mulvihill from Psychiatry. Ashley is an expert clinician who is responsive to their patients' needs and mindful of all aspects of the biopsychosocial care. Ashley is an excellent teacher and good role model for students, residents, and fellows. Ashley has worked collaboratively with nursing, social work, occupational therapies, and others to form a collective and cohesive team. Congratulations, Ashley. Next, I'd like to invite up Noreen Nazir from Cardiology. Noreen is committed to creating and fostering interdisciplinary treatment teams to provide a holistic model for cardiovascular wellness. She's the driving force to the cardiovascular program that was recently re-awarded the American Heart Association Get With the Guidelines Heart Gold Plus Achievement Award. Congratulations to Noreen. Next, we'd like to invite up Jaylene Schoner from Pediatrics. Jaylene is a person of service. While seeing a full caseload of patients, she graciously and competently trains and supervises multiple residents. Her sage advice is offered with empathetic warmth. She is an excellent educator, mentor, administrative leader, and colleague. Congratulations, Jaylene. Next, we'd like to invite up Stephen Pasanti. Stephen is an expert clinician who is responsive to their patients' needs. He is an excellent teacher and good role model for students, residents, and fellows. He also fosters a collaborative attitude with nursing, social work, and occupational therapy, and we say congratulations to Stephen. And then also nominated but unable to be with us today, Michelle Bain, Annie Pollock, Jonathan Modesto, Jenny Wang, and Stacy Laurent. We wish them all well. They're enjoying some time off, and we say congratulations to them as well. I'd now like to invite Dr. Prendergast to come back over and introduce us to our physician attending of the year.
Okay. Our Physician of the Year was an integral part of the incident command structure during the COVID crisis. She teamed up with other members of the UI Health leadership to direct the healthcare delivery system's response to the pandemic. This position required significant oversight of the response in an iterative fashion as more was learned about the virus and the disease process it caused. Real-time alterations to the process were required. At the start, the incident command team found themselves in a 24/7 situation, and our Physician of the Year proved up to the task. While her role in the response to the initial phases of the pandemic was vital and pivotal, her leadership in helping UI Health and the UI Health Physician Group dig out of the COVID hole has been even more impressive. Allocation of scarce resources fell to our Physician of the Year, and these allocations were performed in a fair, equitable, and decisive fashion. Staffing issues, many of which required high-risk exposure to individuals on the front line, were also handled equitably with a focus on both staff safety and critical patient care. While our Physician of the Year proved to be an incredible manager of these operations, her true contributions to the COVID response was in the leadership she showed during the crisis. Her constant communications to the medical staff were not only informative, but comforting as well. During the initial surge, she provided a steadying and calm influence on the physicians, trainees, and staff that was crucial and allowed providers to feel more in control of a very difficult situation. She was always transparent in the decisions being made by Incident Command and willing to discuss those sometimes contentious issues openly with stakeholders. Her approach was firm but compassionate, and she was just what was needed to shepherd the system through a very difficult and trying time. Please join me in saying congratulations to our 2021 Physician of the Year, Dr. Janet Lynn.
I'm not going to cry. Congratulations. When you get this, there you go.
Surprise. Dr. Lynn's mom and dad and her husband.
Okay. You got it.
How about congratulations again, Dr. Lynn?
Nice to meet you. Don't believe any of it.
Mike, I'd ask you, Mike, I'll ask you to come over and say a few words as we wrap up.
When I tried to write down what to say at the end of this session, it became very difficult. I will summarize by saying, separating out any individuals this year in particular, in terms of the special things that they have done, was almost, it's just impossible. There are so many things that people have done over the course of the last 17 months that there are too few awards to go around for the efforts that have happened. I congratulate everybody that was talked about today, especially the of the year people. They represent the special efforts that took place that got us all through this past 17 months. I would like to believe helped get through Chicagoland. They all have made a difference. You all have made a difference, and I think this award ceremony culminates the individual efforts that it took to accomplish what we've accomplished. Everybody that came on stage today should be absolutely proud of what you've done. It is very much recognized and greatly appreciated by all. This session in particular, I find now emotional. Janet was crying. I will find that it is more emotional than most. I thank you all for being here today. Thanks for what you do. Congratulations again to everybody that was nominated, and special thanks and congratulations to those who were named of the years. It is a particularly important of the year time for us. So thank you all, and congratulations to the winners. Thanks.
So again, congratulations to all nominees. You truly, it's humbling to work here beside you. As you leave the auditorium, I'll obviously exit out the back. We do have some individually wrapped snacks for you to enjoy on your way for this afternoon. All of the year, I would ask for you just to stay seated for a few moments, let the auditorium exit, and then we'll invite you and your families back up, and we can take some nice photos for you if you wish. So again, congratulations everyone, and thank you for coming.